SynB 8802, SynB 8802 it's pretty much like you said, it's an E. coli Nissle. So it's a lot of data showing it as a probiotic. So it's a very safe way of delivering. They've genetically modified it so that it has the enzymes to break down oxalate. And so you take the E. coli Nissle orally, and it stays in your intestinal system. And while it's going through your intestine, this bacteria has the ability to break down oxalate. So if we're able to break down the oxalate in the gut, then it won't get absorbed and it will decrease the enteric hyperoxaluria. That's the thought process behind it. So the phase 1b study, what it did is it took the SynB 8802 and it put subjects. There was 11 individuals that were randomized, so placebo-controlled randomized study. They were in-house, meaning they were kept in a unit to be able to manage their diet and then also collect 24-hour urines. They were all patients with Roux-en-Y gastric bypass, so the main cause of enteric hyperoxaluria. And then they were put on a study where they either got placebo or the drug, the SynB 8802. They did do what's called a dose escalation, so they did increase the dose while they were there. So they started off at a lower dose and then took a larger dose. It was divided into 6-day portions, and then they collected 24-hour urines throughout that time. And so since you had a placebo group and a treatment group, you can make comparisons. They did diet control, meaning they controlled the amount of calcium that individuals were taking and the amount of oxalate. So now you have a very controlled study knowing what's coming in and then what's going out in the urine. And then you can look really well at the drug effects. Again, it was 11 patients, 7 individuals received the SynB 8802. And when you look at the results, they had a 38% reduction in urinary oxalate observed in the larger live colonies cell dose set that they gave. And then they also had a reduction with the lower live dose as well. So you had this dose effect. So as you increase the dose, you saw a more significant decrease in the urinary oxalate excretion. So a 38% urinary oxalate reduction, which is quite profound. You know, it was a 1B really looking at safety and an efficacy on the side, but the safety of it, I mean, that's one important thing to point out in this study, even though it's small numbers, right? And they put them in-house for controlled diets, but there was no serious adverse events. And the gastrointestinal adverse events that were experienced equally in the treatment and in the placebo arms. So it seems to be extremely well tolerated. Next steps, you know, it's designing another study looking at likely a similar population of enteric hyperoxaluria patients, those that may have experienced kidney stones already or have had frequent kidney stones, and then seeing if we can not only get a urinary oxalate reduction, but potentially a decreased kidney stone event as an end marker. And I think that would be what we need for that patient population to show that we can actually reduce stone events.